So I'm Julie Warrender. I am the transition lead at Rosewell House, this new intermediate integrated care facility, which is the first of its kind in Grampian.
My name is Katrina Angus. I am a senior charge nurse based at Rosewell.
We aim to provide step up and step down care for the older adult population. So we aim to step up from the community, which enables patients to be admitted for therapy or nursing or medical intervention, as far as possible preventing acute hospital admission. Our step down care is provided here via our acute frailty unit, so anyone that was admitted to the acute frailty unit can come to us if they're not quite well enough for home, but no longer requiring acute hospital admission. We disable people in a hospital, I think, because we felt if we came to a more homely setting, working with our Bon Accord colleagues to deliver enablement care, the patients would feel a little bit more like they were at home rather than a hospital setting. So it felt right that we opened up this service.
It was very exciting. Obviously it faced its challenges because we were all getting used to a new setting. We're all, I've been nursing for quite a long time and I've always been in a hospital setting. But I think this environment is a lot better than a clinical hospital setting for not only staff but patients, because we can work a lot closer, I think, together, and the patients have a nicer environment. It feels more like home.
Uniquely, alongside that, we work with our Bon Accord care colleagues who help us provide that hands-on direct care in a person-centred way for our patients.
We all work very closely together, so whether you're a staff nurse or you are Bon Accord care support worker or service supervisor or an NHS healthcare support worker, we all do very much the same job. We're very person-centred, so it depends on the person as to their goals. So generally speaking, we'll try and get them as independent as possible, whether that's with aids or without aids, whether they need assistance with the likes of personal hygiene. Every patient is individual.
So nice big single area rooms. Everybody has a single room. It's an ensuite room, so they have their own TV. They can have their phones. There's sockets for them to charge phones, bring in iPads or whatever they want to do. So relatives are free to use our communal spaces, which are our lounges, our kitchens, or our garden space outside on a nice day, and they're free to take their loved ones wherever they wish throughout our building. So the idea is it's a more homely setting in an intermediate facility. So we're not quite hospital, we're not quite home, but we're trying to get that feel.
The occupational therapists have the kitchen, which they take patients to make sure that they can manage activities of daily living, and then they can see if any support is going to be required for discharge. They do a lot of work on the units within the patient's rooms, which is quite a homely environment, just to make sure that they can wash and dress if they need basically assistance with anything when they go home. They do home visit discharges or home visits to make sure that the home environment is as safe as possible for a patient on discharge, and if it maybe requires any adaptations, they will organise that prior to discharge. So the physiotherapists have got a nice gym within Rosewell. It's quite spacious that they can take patients through to do various work with their mobility. They've got stairs that they do stair practice with to make sure the patient will manage stairs at home. Again, they will be involved in home visits or home visit discharges to make sure the patient is safe mobility-wise at home, and again will provide any aids that the patient may require. They also do a lot of work, again, within the unit setting around their bedrooms.
We also have a medical team. We work with our Bon Accord colleagues who are support workers. We have service supervisors who play a more senior role within our Bon Accord care team who work alongside our registered nurses. And we have assistant managers for Bon Accord care that help us support the Bon Accord care team as well as our managers from an NHS perspective. On average, on a daily basis, I think we have about 30-40 members of staff between our therapists, doctors and nursing team.
For nursing staff, which includes the NHS staff and Bon Accord care staff, we have huddles with the multidisciplinary team which obviously involves the physios, therapists, OTs and medical staff and nursing staff. We always try and obviously have the patient as the advocate and they make the decisions for themselves. However, obviously if they do not have capacity, then we still try and do what they want us, want to do, like their discharge destination, safely, but we also work very closely with their families. We have a lot of communication with the patients and their next of kins.
So setting up the service has not been without its challenges. I think bringing two teams together undoubtedly has been challenging. However, it's had really positive outcomes for our patients in the fact we're learning from each other. Our Bonacor colleagues work in a real enablement way, which we have learned from that.
Healthcare support workers have been very keen in doing training in observations, so like your blood pressures, blood glucose monitoring, venipuncture, cannulation.
So we're really looking for anybody who wants to work in something completely different and unique. Somebody who's willing to drive a service forward and do what's right for our older adult population. We're really looking for somebody who's enthusiastic, keen, got lots of fresh ideas of how we could make things better, how we work better with our older adult population to understand what their needs are and how we best meet that. So we are keen for anybody that has a drive, a passion and a care for developing, delivering a service.
I think Rosewell's wonderful. It is putting the patient first. It is very much person-centred. We aren't just looking at their illnesses, we are looking at them as a person. It's a lot more of an intimate environment, so we get to know our patients a lot better. It doesn't feel like you're the nurse and the patient's the patient. It is very much you're having that interaction with them and it doesn't feel quite so clinical, even though you are there to be their nurse.